Okay, we can go ahead and get started. I haven't heard the entry tone for a little while. Good morning. My name is Tedra Jackson. I work for the Michigan Developmental Disabilities Council. I just want to welcome you all here today. Before our speakers come on, which will be at around 11:30, maybe a little bit before, they had a prior commitment. We wanted to take some time to kind of assess, to talk to the folks that are attending today about future topics for our webinars. We want to make sure that we're bringing information that you all want and that will be helpful for you, the people that you support, and for your family members. And so when we started this 10 weeks ago, it doesn't really seem like it's been 10 weeks. It seems like we just started like a couple weeks ago. When we started 10 weeks ago, we started with a listening session and just asked people how they were being impacted by the pandemic and what information you needed. And so we want to do that kind of quick. We'll do a check-in now and know what information is still lacking. Is there information related to the state reopening that would be helpful for people? And we really just want to know how people are doing, and if you want us to keep bringing information and keep hosting webinars. So I'm going to just open it up. Please feel free to use the chat feature, or you can just unmute yourselves and talk if you would like. But this is really time that we want to, we're going to just spend some time sourcing the crowd so we can have a good direction on what to do for the future.
Good morning.
Unmuted. Hi. Good morning. Yes.
This is Kathy Sheets at MDDC. I head up the 811 program, and I just wanted to let you know that I think these calls are incredibly helpful for everyone. So everyone across the state can kind of stay on the same page where everyone's at and kind of boost each other up when we need it. And so we can all understand what the struggles are across the state and maybe assist each other in getting through this. I think they're incredibly helpful and assistive.
Kathy, is there anything at MDDC related to the pandemic that would be helpful for people to know about the 811 program? Have there been changes that people need to be aware of that someone from your shop would be helpful in letting us know about?
Well, we do have a complex coming open next month in Detroit with 9 2-bedrooms available, and that is where the individual pays 30%, and then this program picks up the balance of their rent. And then we'll be having more properties come available in Oakland County, Macomb, and Jackson. Those are the ones coming online probably in the next 3 or 4 months. But MDDC, with the CARES Act and all of the information with HUD, we are working as quickly and feverishly as we can to get that money out on the street to all the agencies in Michigan who apply for it and who are eligible.
Kathy, someone wants to know, what is an 811 program?
It's a project-based type of a voucher, and it stays with the property. It is specifically for those who are extremely low income, have a disability of some kind, and receive in-home care or community-based care. And they also need to be non-elderly, so 18 to 61 years age.
Lori says thank you.
Sure.
Thank you, Kathy. Is there anybody else that wants to speak at this time?
How about voting in the COVID era?
Barb, say that one more time, please. I didn't get that.
But how are you going to vote in the COVID era?
Oh, voting. Oh,
Yeah.
Barb, that would be a great topic.
that I only have a voting by mail, but how about people that are going to vote by mail?
May I
Voting?
add a little bit?
Sure.
Yes, Mr. Williams.
Thank you, Miss Barb. It's always a pleasure to hear from you. NOAA is working on a project as well as the DD Council on voting and voter outreach and what their the laws, what does accessibility look like, things of that nature. So that is in the works, and I can work with Tedra to bring some people in to talk a little more about that if she'd like.
Okay, cool.
I think that would be a great topic. Maybe in July ahead of the August primary. I think that would be great. Thanks, Barb.
Noah, you was adding something?
I was about to add something. So we're having 3 webinar trainings for pretty much like most of the disability organizations like throughout the state. So it's going to start from like July 14th, and then the second one's going to be the 21st, and then the last is going to be the 28th. And they're going to be at 1 p.m. So
Noah, who's we?
Really what I'm saying is both MPAS and Self Advocates of Michigan.
Okay.
Me.
Is there a, hi Sarah, is there a link? Could you post the link with information, or can you send me the flyer and I can send it out to the, to our listserv?
Yeah, but I need to check with my staff first about when's a good time to meet so that we can actually get that done like immediately as possible.
Okay. Sarah? You're up next.
Basically what Noah's saying is, because I've been helping him too a little bit, it's called the Save Go Voter Project training that we decided to hold in July. We're holding 3 of them, and basically I've been kind of trying to help him too, because I've been like involved in some of the meetings.
So it's a national initiative if it's a state thing. Well, that's great.
Yeah.
It would be good to have that here.
Yeah.
Robert,
I'll lower my hand.
Robert is saying it would be nice to have a webinar with speakers that could answer questions on expectations for transition from H0043 to H2016 CPT codes to support people in supported independent living programs. Robert, I'm going to have to ask you if you could let us know what H0043 and H2016 CPT codes are. While we're waiting for Robert, billing codes. I need a little bit more context before I could, so we can help to line up a person that could speak to us about that.
Tedra, if you'd like, I could offer some context.
Great, Annette, thank you.
So the state has put out a memo that they are discontinuing the H0043 code. That is the per diem code for community living supports. So a lot of people who are served by agencies historically would be paid a per day rate to support them. The state is making the shift that effective October 1st, the per diem code is being retired, will not be available to be used, and all services need to be authorized using H2015, which is the 15-minute code for community living supports. So I think a lot of agencies that have their entire systems focused on, we get a per day rate, are having a harder time understanding how to move towards 15-minute service authorization and reporting and billing in the transition.
Okay. Thank you. So I can talk to the people at BHDDA and see if we can get somebody out to give us an update or some guidance on that. Someone wants to know if we can provide information to parents of adults with disabilities about in-home respite services, as well as licensed respite homes for adults. Parents of adults with the HAB waiver. Okay. We can look into that. I guess I would ask, is that related, Pat and Trish, is that related to the pandemic, to COVID-19, or just in general? In general, okay. There are a couple questions that we wanted to know. So I'm gonna open a poll. We have 2 questions. One of them is, how would you like to receive information and updates? We want to make sure that we're getting people the information in the manner that they want it. And so we have 4 choices, which I realize it's not the end all be all of the communication choices, but it's what we're working with right now. And then we want to know about what resources people need now. And so I'm going to launch the polling. And if you are connected via Zoom, if you would participate in that poll, we would appreciate it. And that will just help us to make sure that we are continuing to give information on resources and information in a manner in which people like it. Sarah, go ahead and unmute yourself.
The poll, what's the poll for? I mean, how will you receive information for what?
From the council.
Oh, okay.
How do you want to receive information and updates from the council? And actually, potentially from some of our partners.
And Tedra,
Yes.
on question number 2, what resources you need now? You're only allowed to select one. And there may be other resources needed.
There may be. This is my first time setting up a poll, so I probably did not select multiple choice.
That's all right, Kendra.
Thank you, Sarah. I'm going to leave that poll open for just about 30 more seconds and give a few more people a chance to participate. And I believe that I saw that I admitted both of our presenters for today into the meeting. We have another person that wants information about the HAB waiver. Tina, I'll read your question aloud as soon as I close the poll in a few. Thanks to everyone that participated. Okay, we did have one more. I want to know also about the HAB waiver. My daughter lives in a group home and has the HAB waiver. She was on a home visit when the stay in place order went into effect. Her worker from CMH states that she will lose the waiver for April and May and then have to I'm sorry, my scrolling just messed up. Her worker from CMH states that she may lose the waiver for April and May and then have to reapply for June and so on. Is there anyone on the line that could speak to that?
Hi, my name is Megan Frender. I am the HAB waiver coordinator for community mental health in Clinton, Eaton and Ingham counties. So with the HAB waiver, actually, you just have to have one qualifying HAB waiver service each month. So because she resides in an AFC home, they should be billing for CLS and personal care daily. for that individual. Also, your supports coordinator should be able to provide a telehealth visit with your daughter, which would also count as a HAB waiver service. So as long as she's receiving a habilitative service each month, she's not at risk for losing the HAB waiver. When we talk about somebody losing that HAB waiver benefit, that's if for 3 consecutive months they don't receive a habilitative service at all. So that might be if she was in the hospital or if she returned home. Okay, so if she was home for April and May, as long as she received a HAB waiver service in March, and then again in June, and again, that can include a telehealth visit with her supports coordinator, there shouldn't be an issue with the waiver system.
Thank you, Megan. And I believe that Tina, part of that question is going to get answered with the webinar, and both of our speakers have joined us, and so I am going to locate them, and we can go ahead and get started, because I know that everybody is anxious to hear what they have to say. Belinda, you're going first?
Absolutely. We're anxious to hear what you have to say as well.
Great.
So Morgan and I are going to navigate this presentation and then hopefully have an opportunity to respond to questions that you have along the way. Tedra, do we have, what's our timeline for this?
We are finished at 12:30. So
Okay.
we have just over an hour and 10 minutes.
Okay, and then I heard as I called in that people may have had some questions prior to our getting online, so we can add those if you need more clarity around anything that was asked.
Great, thank you, Belinda.
You're welcome. So everyone, I'm hoping can see our presentation, and I can introduce myself. Morgan can introduce herself. My name is Belinda Hawks. I'm the Division Director of Quality Management and Planning within BHDDA, or Behavioral Health and Developmental Disabilities Administration. And today we'll be talking about updates related to behavioral health waivers. Morgan? She might be on mute, so Morgan Vandenberg will be joining and helping to answer questions at the end of the presentation. And Morgan is the Federal Compliance Manager for behavioral health under my division. So the second slide we have today is just an overview of what we're going to be discussing today, which is the waiver status. And folks might think about the waivers that we're talking about as the waivers that support children and adults with IDD, called the Children's Waiver and the HAB Supports Waiver. And then we have the waiver that supports children with serious emotional disturbance, called the SED waiver. We're going to talk a little bit about telehealth and where we are with our policies related to the flexibilities and the options to continue to provide services under a telehealth platform or virtually. We're going to talk about the stability plans, which were required of the PIHPs to submit to the department related to how they were going to assure network adequacy of their providers and the services. And then we're just going to touch on some resource options and questions at the end. Next slide. So we had an opportunity to ask for federal waiver or flexibilities around our waivers, which included our broad Medicaid waiver authority. It included our 1115 waiver authority, which covers those who are outside of our children's waiver, our HAB waiver, our SED waiver. And then the last opportunity to get federal flexibility approval was what we call the Appendix K request, which covers our 3 waivers that I just mentioned. So we're going to talk a little bit about each one of those as we have applied for and received approval for 2 of the 3. And we can talk more about the specifics within each one of those requests as we go along. So the first one we're going to talk about is the 1135. And that is a broad umbrella waiver request that allows us to obtain relief for Medicaid services, typically, again, very broad, so it covers all of Medicaid, not just behavioral health. It allowed for flexibilities around telehealth, perhaps around making sure that we considered waiving prior authorization requirements if those were needed so that people could continue to receive services during a national disaster. It allowed for providers to be providing services within Michigan, even though they were located or licensed outside of Michigan. It suspended certain provider enrollment requirements, again, making sure that we gave people access to providers and services without delay. And it adjusted performance deadlines and timetables, again, not waiving those, but adjusting those to allow for flexibilities, given that some of those deadlines were during the COVID-19 disaster period and could not be met. Next slide. So we talked a bit about each one of them, and I want to focus on the fact that we made these requests with an effective date back to March of 2020, understanding that that was when we began to experience the effects of the COVID-19 impact. So we did go back to 3/1/20. We asked again that we extend any pre-existing authorizations that were in place through the disaster period. So it permitted services to be approved and to be continued, even though there might have been expiration of those authorizations during that period. It did temporarily provide enrollment and reimbursement of new providers or out-of-state providers that met the CMS requirements. It again allowed for broad-based approval of and reimbursement of services rendered in alternative settings and telehealth and telephonic expansion. So the difference between telehealth and telephonic is telehealth covers both virtual platforms of audio and visual, where telephonic is audio. And then there was flexibility in the person-centered planning process and plan. And that really had to do with making sure that if your plan expired during this pandemic, that your services and your authorization for services continued, even though expired, until it was possible for a new plan and a new discussion or meeting could be held. Next slide. And I know we're going through these pretty fast, and I'll be happy to answer questions at the end of the presentation. And we can go back to these slides if you have a particular slide that you had questions about. In the 1115 request, that gets a little bit more specific to behavioral health. And again, we wanted it to take effect March the 1st. Of the 3 requests, this is the one that we have not received approval on yet. So we have a call with CMS this afternoon to cover any questions that are remaining with CMS related to this request. So under this 1115 waiver demonstration flexibility request, we asked for very similar flexibilities as was asked for in the 1135 and in the Appendix K. And it basically addressed all beneficiaries in behavioral health who were not under one of our C waivers, under the HAB waiver, the SED waiver, or the children's waiver. Next slide. So the 1115 request, again, addressed some flexibilities already discussed around person-centered planning. It expanded the telehealth options to allow for many services. Most of our behavioral health services were allowed to be flexible options around telehealth. It allowed for the annual reassessment and level of care determinations to exceed any 12-month authorization period. And it modified any level of care evaluations or reevaluations and eligibility that may again have been expiring during the pandemic to be extended. It allowed for flexibility in payment for services and supports to providers for those individuals who may have had to be transferred temporarily to alternative settings to continue to get their support. It again allowed for payments to certain provisions of service. That's our direct care wage, or what you might have heard as the premium pay during the emergency. And again, it modified the data requirements that may have been due during the time of the pandemic. Next slide. So the last request we made to CMS is very, very narrow. It only addresses requests for flexibilities around those 3 waivers, which we call the 1915C waivers. Again, that's the Habilitation Supports Waiver, the Children's Waiver, and the SED Waiver. And this one did get approved, and there'll be additional training and assistance offered to the field related to specifics around how we move from approval to implementation of those flexibilities. But what we asked for was adding an electronic method of service delivery, so that goes back to allowing you to continue to receive services without having to have an in-person or face-to-face interaction. It added potentially additional services to address any additional needs during the time of an emergency. It adjusted the process requirements to decrease any administrative or operational burdens. So anything that, again, was process-oriented around eligibility or re-eligibility, we were able to make adjustments to those timelines. Next slide. Again, some temporary changes. I want to point to the timeline again. We went back to 3/1. And what's unique about this particular request is it allowed for us to extend our request beyond the emergency time for up to a year. So we were able to actually get approval to have some of these key changes extend through February 28th of 2021. And those changes include service limitations to be exceeded. So again, we can touch on some of those in the next slide, but we were able to relax some of the requirements around non-vocational services, private duty nursing, respite, and CLS, just to name a few. We were able to expand services where services may be provided. Again, that allowed for services to be expanded beyond where maybe the service was allowed to be provided. For example, out-of-home non-vocational services by its name intended to be provided outside of the home, but we were able to ask for and get approval of that service being in the home as well as outside of the home in a telehealth option. It allowed us to modify provider qualifications related to what were minimum requirements versus all requirements, so that providers could continue to provide services if their particular certifications or renewals were expiring during the pandemic. It allowed us to modify extend our level of care and reevaluation requirements to make folks eligible and re-eligible for these waivers. Same thing around modifying this person-centered planning process. We did not want people to have their services end because their authorizations, our plan was due to be renewed. It temporarily increased payments. And again, that is what you will have heard about or may have heard is continuing, which is the premium pay payments to direct care providers. And it temporarily allowed for payment to services for the purpose of supporting people in acute care hospitals or short-term institutional settings like nursing homes. So that really speaks to people getting support if during this emergency time they received services in another setting as well because of their COVID status. So if you are someone you know who may have been COVID positive and needed to be hospitalized, but needed to continue to get support from the staff that they were receiving support from in the community, that the possibility is there for those staff supports to follow them into that hospital setting. Next slide. So specifically, things that are in that request, that Appendix K request, is around the HCBS rule. So folks might know that the Home and Community-Based Service Rule is going to take full effect in March of 2022. But during this time, the state is working to assure that everyone receiving home and community-based services follow the rule requirements. And so some of the things that during a pandemic like COVID-19, we were allowed under this request to relax or adjust those rule requirements to make sure that people remain safe. So it allowed for providers to make sure that people were safe in being exposed to COVID-19 and for other individuals in the home. It limited community participation for individuals who may be at high risk to obtain the illness. Doesn't mean that folks can't go out in the community, but if folks were particularly identified as high risk, that providers had the flexibility to work with that individual in assuring that they were safe, and allowed the providers of HCBS services to implement social distancing measures as feasible or required by law. The services that I talked about that were allowed to be provided in a virtual way or an electronic or telehealth way are listed here. So these are not all of them, but the majority of them include case management, personal care, any kind of monitoring that can be done virtually, out-of-home, non-voc, supported employment, training, just to name a few. The full list, it would be located on our webpage, and we'll be pointing to that link at the end of the presentation. And then process changes that occurred as a request and particularly around these waivers, again, allowed for an extension of our reassessments and our reevaluations past that 1-year date. It allowed our options of conducting evaluations, assessments, and planning meetings virtually rather than face-to-face. It adjusted our authorization elements that are required in our waiver. Any assessment requirements that needed to be adjusted due to COVID were also included. And it allowed for us to have electronic signing off of required documents, such as person-centered service plans. Next slide. So I talked a bit about telehealth, and we have heard a lot from providers of service, and I'd like to hear from you as well on whether you appreciate the continued extension of approval of telehealth options, which allows for services to be delivered in a virtual platform and for people to get their supports and services electronically or virtually versus in person. So the things that we're doing right now is working with Medicaid policy staff to look at each service that was approved temporarily and look at what services can continue to be approved in the short term and the long term. So there's a work group that's been formed with MSA to address those telehealth options continuing. And then we understand that there are several House bills that are in play going to the governor's office, may have been signed by now, I haven't checked today, related to telehealth going forward. So for us, as we know, we're going to continue service options around telehealth. We're going to start to provide training and support to the field to understand what that means specifically, and we'll be offering policy guidance as well. Next slide. The stability plans you may or may not have heard about, but those are plans that we asked each PIHP, our prepaid inpatient health plan, that oversees the network of providers that provide support to everyone within their CMHs. They had to provide a stability plan to the department. This was a few weeks back. And those plans had to address how they were going to assure the network of adequate providers continues during this emergency time. So every prepaid inpatient health plan, or PIHP, submitted a plan to the department, and those were reviewed by the department and have subsequently been approved. All 10 of the PIHPs submitted, and all 10 have been approved. So as we have approved those plans, we now are responsible for assuring that the PIHPs have honored and implemented what they said they would do in those plans. So every month, the PIHP has to submit something to the department for review and to assure that they are providing the services as they plan to in the stability plan submitted. Those submissions are given to the department on a monthly basis, and the first one will be due at the end of this month. Next slide. So as I mentioned earlier, we have a website that is dedicated to all resources that are behavioral health, as well as resources that are links to other guidance and policies, both for licensing under LARA and for Medicaid under MSA. So I would encourage you to go to that link on a regular basis, because we are regularly updating that policy and those guidance documents as they change in response to the governor's orders changing, and as we move forward in the phases of the pandemic. So it's a good site to go to, and I encourage everyone to check it out. Next slide. So this is, again, another opportunity to take a look at what the governor and the state of Michigan has in the way of the Stay Well policies and executive orders. So I would encourage everyone to also go to this site to find out more information about what Michigan is, what phase Michigan is in related to the pandemic, and what new executive orders and directives have come out from the governor's office. And the last slide, I think, is our contact information. So if you have additional questions from this presentation, feel free to reach out to myself, Belinda Hawks, or to Morgan Vanderberg, related specifically to those 3 waivers discussed. So what questions does anyone have?
Belinda, we did have a couple questions that came through while you were talking. So I'm going to read
Okay.
those first, and then I'm going to check with Tracy, who's manning the Facebook Live, to see if there were any questions on Facebook Live. Then we'll open it up for questions.
Okay.
But before we do that, I just wanted everyone to know that we realize that this is a lot of information that they're giving, and it's a lot to digest right now. And so you're going to have the opportunity to email me questions for a week to jacksont7@michigan.gov. And then I'm going to get them over to Belinda and Morgan, and they're going to answer them, and we'll create an FAQ and send it out to people with questions that they had based on the webinar today. Because we do realize that this is a lot of information. And so we wanted to give people an opportunity to really think about it and process and come up with their questions if you weren't able to formulate any right now. And so the first question is, when will we be able to obtain the Appendix K specific information, and when will PIHPs be required to ensure these supports and services are being obtained? It's a two-part question. So that's part one. And then, can the supports provided by CLS, who are patient advocates, how does one ensure payment of stall that some are refusing the support and saying it's double billing via Medicaid? So it seems like the first question is, when will people receive the Appendix K specific information, and when will PIHPs be required to implement, make sure they're implementing?
Yep, and Morgan and I have talked about making sure that the information is posted on the link, the web page that we just showed you, the Buddha updates or BHDDA updates and resources page. So so that's the site that will be posting the approvals of all three of those flexibilities. So 1135, 1115, once approved, and the Appendix K. And if you remember in my review, the Appendix K went back to March the 1st. So we have an expectation that PIHPs will immediately, if not already, be implementing any of the flexibilities that they're able to in March. And so we have been providing the PIHPs with these updates, understanding that we had not received approval until last week. We expected them to begin to do the work they needed to do to assure that services were provided. And you'll find that in our guidance and our policies that are on this page that speak to what the expectations were throughout this pandemic. And in some cases, we'll expect this to continue through that February 28th date, depending on what it is that we've asked for. The second part.
The second part is staff. It's staff, not stall. I just got the confirmation.
So can you reread that one again?
And the supports provided by CLS, who are patient advocates, how does one ensure payments of staff that some are refusing the support and say it's double billing via Medicaid?
Yeah, so I guess I'm confused on the question. If staff are not getting the premium pay, if that's part of the question, then we would want to know about that, because the PIHPs have received or will be receiving that payment this month, retroactive to April for the premium pay, and that will be extended now under the order signed by the governor through September for the premium pay to continue. And they have to report up how they have assured that the staff that are approved to get that premium pay obtain it beyond their base pay. So it's in addition to what they would have been paid before this was approved. I'm not sure about the double billing piece of the question, so I'm going to need more than that.
I actually just asked the participant if they wanted to unmute and ask the question.
Okay.
So while we're waiting to see the answer to that, I'll ask Tracy if there's any questions or comments from Facebook from Belinda.
Not at this time.
It's the first time I've been on Facebook Live.
Carolyn, go ahead. It's you. You can go ahead and ask your question.
Hi, Ms. Hawkins. First, I'd like to thank you for doing this presentation because it really clears up a lot of information that we've been hearing on the backside. Our son does have a home, have the supports waiver, and our concern was if he needed a CLS staff person to go occupy him as a patient advocate in the hospital, we're being told if the hospitalization is paid for by Medicaid, having a CLF staff person to be the patient advocate would be a double billing under Medicaid.
Okay.
I have seen though, there's been the HHS in Connecticut thing that the governor sent out that stated the person has the right to have that patient advocate with them, especially if there's communication concerns, behavioral concerns, or things like that. So I'm just asking for clarification on that. I do have one other question. In Macomb County, we have not seen supports workers or care providers. I have not seen the premium pay as of yet. I just wanted to let you know that too.
Well, thank you. And so the first part of your question now I better understand. Yes, it's always been, this was pre-COVID, the expectation that the hospital would cover all necessary supports and services to an individual admitted. What we have understood is that COVID brings an additional complexity to anyone that's being admitted. So under this this temporary flexibility, it is allowing for services to and supports to continue to follow that person if they're hospitalized. So it would not be considered double billing. The provider would have to make sure that they are reporting the location of the services, so in the hospital or in the nursing home, as a part of their reporting of their time, but that is possible under this approval.
She says, thank you, Belinda. Another question we had in the chat was from a mother whose daughter resides in a group home but was at the family home from March 12th to June 2nd, and she wants to know if they can receive payment since the daughter, for taking care of the daughter since she was in the family home for that period of time.
Yeah, unfortunately, we don't have a means or any authority to reimburse the natural support during the time that they had their family member with them. We did pursue that question with CMS, but we were unable to pursue and get approval for that.
Thank you, Belinda. Someone else wants to know, are CLS staff required to wear a face mask in the consumer's home?
Yes.
Thank you. Another question, would you be able to provide some talking points to help explain to people with disabilities and their families why there are benefits of enrolling in the HAB supports waiver? A lot of people see no reason to want to transition to the HSW.
So I'm hearing people want more specific information about the HAB supports waiver and what the benefit offers that perhaps is a richer benefit or additional service benefit to what they may already be receiving. So I know that Morgan, if you're able to speak to it, are you guys updating the website related to the different waiver benefits? don't know if she's able to come on.
I'm not sure because
Not hearing.
I have chatted with her, so I know that. Oh, she
Okay.
wants to unmute her. Hold on one second.
Oh,
I don't see that she's muted.
well, we do understand that the waiver benefit, just the eligibility process can sometimes be more work for people. And it's an opportunity, I think, to recognize the intensity of the need and the type of benefit array that can be offered. If, though, folks are satisfied with the level of service they have, and they are receiving the supports they need, then I'm not sure what we think might be of benefit, but it's a possibility. So if it's helpful to have sort of a comparison with talking points, we can definitely look into that and make sure that's posted on our webpage.
There was a follow-up question to the mask, Belinda. Do we have something in writing saying staff in homes need to wear masks?
We are working on, well, we have what the governor has asked us to do, right? But we also have guidance that's coming from both BHDDA and MSA. I'm on a work group. In fact, we met yesterday that will provide additional guidance related to the mask and how staff and people served can be protected while receiving services. So stay tuned, that should be coming out within the next week.
Okay, there's another question. Someone is saying that in follow-up to the question about the hospitalization, they heard it would be billed under the respite hours instead of CLS hours. So Belinda, are you saying it can be CLS hours that are used?
Yes, it can be CLS. That again is a pre-COVID requirement because CLS could not be considered billable in a hospital or institutional setting because it is community-based. But because of the approval for the flexibility under this waiver, we were able to get a waiver of that.
Thank you. Another question, what is happening with the overnight health safety supervision hours? We've been told that there is no code to use and no direction from the state on using this option, even if it is listed in the PCP or the IPOS.
The overnight health and safety and support is approved. There is a code. I don't have it memorized, but there is a code and people should and can offer that support now. So we did a quick check on encounters just to see how many encounters were submitted under that code, and we didn't see much. So we do understand, again, during the COVID emergency, that may not have been possible. But the benefit's been, I think, open and available starting in October, I believe, or January. So it's been available to providers to use, and if it's authorized in the plan, should be provided.
Thank you, Belinda. I see there's two hands raised. Sarah Carmody, do you have a question?
I can't hear her.
No, I don't have a question. I raised it a long time ago.
Okay.
Sorry.
No worries. Pat and Trish, do you have a question? Belinda, can you answer a question on recipient rights?
I can hear the question. I'm not sure if I can respond, but I can maybe point you to the person that can.
Great, thank you. Tina, go ahead with your question. And Morgan just posted the overnight health and safety information in the chat, in the link to the covered service. Tina is typing her question. So it'll just be one moment, Belinda. Are there any other questions for Belinda while Tina is typing her question?
Tedra, am I able to just ask the question?
Yes.
Okay. Hi, Belinda. It's good to see you.
How are you?
Good. I just want to note that during this COVID-19 period, the process for getting people activated on spend down and meeting their deductibles so that their Medicaid can be activated is much, much improved. Now, I suspect it's because of some of the adjustments that have been made to increase flexibility and not let people be negatively impacted during COVID-19. So my point, I guess, would be, gosh, if things could continue post-COVID with the way the MDHHS workers are quickly activating people's Medicaid once we send over proof of their deductible being met, if it could continue long-term, it would be wonderful if we could gain some benefit from all the challenges we're facing now by saying, hey, if we can work together on this, we can help people get their Medicaid activated. So I don't know if that's but it's working now, and it has been for a long time. So it's good feedback I'm seeing.
That's good to hear on that. And yes, you're right. The 1135 did allow for some relaxation of basically Medicaid ignored the requirements around what people needed to continue their Medicaid during this. So I'm not sure that it's going to continue, because they're going to have to bring those requirements back into play, but I will definitely pass that on.
Yeah, even just the processing's been expedited, and the retroactive approval, so we're still getting the proof to them. They're just acting on it much faster. So
great.
Yeah, anything we can do to keep that would be great.
Absolutely.
Okay.
We had a question. Is there any discussion on the overnight health and safety code to be available under the state plan? And then Morgan posted the overnight service policy bulletin published earlier this year. Thank you, Morgan. Morgan is not connected. We can't get her audio working, so she's just kind of working behind the scenes.
That's good though. At least we can get that working for her behind the scenes. So we did consider and have looked into expanding overnight beyond the 3 waivers. And at this point, frankly, given the financial situation of the state, it's not expected to be pursued at this point.
Thank you. So we have Tina's question. After a worker is found guilty of abuse, how can the worker go to another home and work? I want to know why this isn't a requirement for group home workers. I was told because they don't hold a certification. Why doesn't the abuse follow the employee when found guilty?
Yeah, that's beyond my scope, but I understand and am concerned as well. I do know that as people move around as a worker, that there is an opportunity to get a clearance, so to speak, to assure that they have no I guess substantiated would be the word, investigations related to protection for adults or children through DHS, but I don't know what that process is for CMH to CMH clearance related to workers that have been investigated and found to be substantiated abuse or neglect. But I do talk with the state director of the Rights Office on a regular basis, and I can bring this forward to her and potentially maybe Tedra have Ramey send something back out to the group.
Thank you, Belinda.
You're welcome.
Belinda, will you take another question?
Sure.
So as about the stability plans, you said that all 10 PIHPs submitted one and they were all approved. My question is, are they all similar, and did BHDDA put some requirements around what they should be putting in their stability plans, and how, if they're dissimilar, how does that impact people who may move from one area of the state to the other?
Yeah, this Bandela?
Yes.
Yeah, so the stability plans are different. And what we basically pointed back to is, and I'm looking for it now, a contract and federal requirement called the 42 CFR. And there's a number 438.68, 438.206, which is a requirement of the prepaid inpatient health plan to establish and maintain a provider network that is sufficient to provide adequate access to all services covered under the contract. And so that is the authority by which we made that requirement. And I appreciate that there would be potential differences in what might one PIHP might have submitted versus another. And I will check in with Jeff and Al on what that monthly monitoring will look like. I haven't seen the template yet to know what that would look like, but and to see if they can make that available to you as well.
Belinda, are the stability plans public?
Not that I'm aware of yet. I'm not sure what the plan is to make them public.
Okay, thank you.
Yeah.
Another question that was asked a while ago that I totally missed was the latest information we have been given was that support coordinator contacts were no longer considered a HAB waiver support.
Right, that's true. Support coordination, our case management, our targeted case management was moved to a state plan benefit. It doesn't mean folks should not be getting those services who are on these waivers. It just means that it came out of the waivers specifically as a benefit or service and went into a broader state plan benefit. So the services should continue to be provided. They're just not tracked as a unique waiver benefit.
Thank you, Belinda. Are there any other questions? Well, before I say that, Tracy, do we have any questions or comments from Facebook?
We do not.
Thank you. And we did get the, Annette did provide us with the memo, so we'll be able to get that to the person on Facebook that wanted the memo.
Okay, perfect.
Are there any other questions? I'm checking the chat. There's been a lot of activity with links and information. I want to just make sure that we have not left anyone's questions out. I guess I have a question, Belinda.
Sure.
Is it okay for a CMH to not allow someone living in a group home to go out and, now that the stay home order is lifted, to go out in the community with family or friends?
No, the stay home order, as you said, is lifted. The stay well order is new, and it is, as we all know, we are able to move about our community like we weren't before. We were discouraged before. So no, folks should be able to move about their community. I think the question is, what kind of support do they need to do that safely? And do they have the appropriate equipment or support to make sure they're not in a vulnerable situation that might expose them?
Okay, thank
So
you.
Belinda, if there are individuals that are being told that, I've been in touch personally with the group home manager who's told me that a client can't visit because they're under some extended measures based on the living situation that the individual's in. So it's similar to the question that Tedra asked. How would we go about if that's still being, if people are being denied, their visits or their ability to make plans?
Right. So Yasmina, the one distinction is, are leaving their home to go out in the community, or are they in a home that they want visitation in their home? And so if it's the community-based option, then absolutely people should have the freedom to do that. And I would start with the rights office if that is being somehow impeded. If it's visitation within their facility and it's a licensed facility, you know that there are continuing orders around that, right?
Yeah, no, this was an individual trying to go into the community.
Yeah, I think people are getting those two confused, and they're applying it broadly when that's not the case anymore.
Okay, and that would be the rights office of that particular CMH?
Correct.
Okay, thank you.
You're welcome.
There's one more question, Belinda.
Okay.
I've heard that people who have intellectual or developmental disabilities and live in group homes are having a hard time getting access to the Wi-Fi in their home. They are being told they can't access it, but staff can. And in parentheses, it's not that staff are using it for work. Is that okay? Is that an okay?
Well, no, people need to have means to communicate, and that includes virtually. So if the Wi-Fi is a part of that option for people broadly in that setting, then there would be no reason to restrict access unless there was something specifically in that person's plan as to the reasons why that needed to be in place for their own benefit.
Okay, thank you.
Yeah.
I have a follow-up question. Belinda, so is there any point at which something like Wi-Fi is going to be considered a basic need or a basic provision? Because right now people are so isolated, no Wi-Fi, no Zoom, just telephone saying this is still going on and I'm sorry, I can't see you.
Yeah, I think that's definitely on the horizon and shorter than later, because two things. One, people who wanted to access their services via telephonic or telemed ways, they couldn't if they didn't have the strength of their Wi-Fi or Wi-Fi at all. Secondly, if they were able to do it telephonically through a cell phone, if people had limited minutes, right? Or they didn't want to use up all of their minutes just to get the support that they would have received in person before. So there is ongoing dialogue about if you're going to allow for telehealth to continue, how do you make sure the platforms and the technology is available across the state?
But it shouldn't just be for telehealth. You have people who have not left their CMH supported group living environment for 3 or 4 months now, have physically not left that building. And
so it's for social as well.
right, I'm saying for social and mental health, right? And then they're not even able to connect by Zoom like the rest of us have been able to with family or friends or by video chat, because they often don't even have a phone with, you know, the data plans and all of that to do that.
Yeah, I think that will be included in the plan. Okay. Absolutely.
Yeah, it's super isolating. Thank you.
Yeah, I'm hearing failure to thrive and all sorts of results that are both for any one of us that are socially isolated, right?
So Belinda, I've got a comment that recipient rights in Port Huron is saying that people will need to pay additionally to access the Wi-Fi in their group home, and they just can't afford that. And also from this same commenter, some people that use assistive technology need to connect to Wi-Fi to be able to use the technology.
Where was that again, Tedra?
Port Huron.
Okay. I will look into that.
Sarah Carmody, do you have a question?
I know that, I don't mean to change the subject, but on the international call that I am on daily for self-advocates, we have a person there that's very passionate about it. He's kind of like a staff, but he has a disability himself. But he said he's been advocating it for 20 to 30 years. And so basically people have pushed him back. And so he's kind of tired of waiting on people to advocate in this area. And so basically he's just doing it with the 2 Zoom meetings internationally.
Right, so people do need need access to Wi-Fi.
Yeah, and I know at one point he was asking me if I knew of people here he was asking all of us, some of us in the group, because he's wanting to put together a conference, because we've been doing these Zoom meetings 2 times daily through Zoom, and through the Self-Advocate Speaking Freely group. And he said he was wanting to put a conference together to try to advocate for this more, for getting like assistive technology to people in like group home settings and stuff like that, and institutions and stuff.
Right. Any time that your service or support is reliant on a particular technology, that technology should be a part of what's covered, right?
Right.
So I'll definitely be bringing these concerns and questions back to.
And I did give him, when he was asking all of us in the group who we knew in our state that would be strong enough, that have a strong passion for it, I told him, I gave him Jen Mullins' name, and then I also said, I left it open, like there probably others, I just don't know who all would be interested in advocating for this kind of thing. So that's what I told him. I hope I did the right thing.
It's important to bring it to the attention of everyone. So that I think that is key to us moving forward. Absolutely.
Right. Well, I just thought I should bring that to your guys' attention too.
Thank you. Appreciate it.
All right.
So we have a participant, Belinda, that says that her son was denied the right to have his iPad replaced via his person-centered plan, even though it was provided by his person-centered plan, and therefore he was denied all access to telemedicine to do the goals in his plan, even communicate as he has for the last 8 years with a functioning iPad. And they said they've contacted impasse, the state, and they feel like it's an obvious violation of his rights under Medicaid.
Right, so the iPad, I'm assuming, would have been covered under assistive technology to assure that he got the services and supports he needed. So if that iPad is not functioning, then I do think it's important to work with the CMH and appeal any decision through your fair hearing process or your due process to assure that you have an opportunity to talk about how important that technology is to your son. I'm not sure if that's happened, but that would be the process I would follow.
Thank you, Belinda.
Could I just ask a question about that? I'm sorry, Belinda.
Sure.
This is Carolyn. That was my question. We went to a hearing. We actually went all the way to the state, but the information provided wasn't accurate. During this, his needs changed because of behavioral concerns, because he didn't have a means to communicate. And there was a request put forth to authorize under goods and services for the replacement. They denied him even the right to be able to do an authorization. And I did request a state hearing regarding that, but within all this time, he's being denied access to what's essential in his plan. It's in his plan of service. And that's the thing I don't understand. This, even the governor's executive order that indicates that a person with a disability should not be denied access to COVID services during COVID. This has caused a lot of problems, and I'm trying to understand why nobody's holding CMHs accountable for these type of obvious violations of a person's rights under Medicaid or as a person with a disability. It seems it's not even happening. His recipient rights office wouldn't even take a complaint from his supports coordinator regarding her ability to not even be able to put the authorization through.
Well, I guess a couple of things is you can definitely expedite your request for a state hearing, but in the meantime, you can reach out to the rights office yourself. You don't need to work, through the case manager.
Oh no, and we did, and they denied us. They wouldn't take the complaint.
Oh, interesting. I mean, was customer service involved?
No, we called recipient rights. We tried to make several complaints with our recipient rights office, and they would not take them. They would not investigate it.
Customer service is another arm of that within the CMH that I would probably pursue. In the meantime, see what you can do to make a request to the State Fair Hearings Office around an expedited request.
We already did it. We already went to hearing. So,
okay.
Yeah. I'm just trying to figure out, though, the system doesn't seem to support getting what the person needs, within a timely manner. We asked for an expedited hearing. It was 2 months. And I understand the whole COVID thing, but I don't think people understand that if a person doesn't have a means to communicate, their
Right.
everyday living and quality of life is being affected. I just wanted to let you know that that's happening.
Okay.
It's a systematic denial of services in Macomb County that it has happened for quite a while. And we just don't know how to get around it. We've tried every option.
Can I ask you to just send something to me directly?
Okay.
With the details, and I can try to have our customer service connect with the local Macomb customer service and get more detail.
Thank you.
You're welcome.
Belinda, we have one more question here. So it's 12:24. We've got a question in the chat, and then we have a question on Facebook. It says in that group home residents can access the community. Can they also access day programming if desired and with safety precautions?
Yeah, day programs and other sort of community-based programs are starting to reopen. And so I would be working with my case manager and the team to assure that there are safe practices in the reopening and what the plan is to begin the reopening of those kinds of services. So every CMH has sort of a unique way that they might be taking a look at based on the physical plant of where that service is being provided, what they need to do to assure that people are distancing and have the proper PPE equipment and disinfectant, etc. So services are reopening, and I would just work again with your case manager to make a determination about your particular situation.
Thank you. And Tracy, let's go to Tracy for the question on Facebook.
Right, so Marie has asked if someone receiving services from CMH wants to coordinate services using text messaging, can the CMH refuse? For example, scheduling meeting times with their support coordinator.
So the way that the person wants to be able to communicate with their support coordinator is via text.
Correct.
Okay. Again, I think there's some need to protect folks' privacy and assure confidentiality. So that might be what's in play. So I would again check with the CMH to see what their policies are around the flexible options that people have in order to assure that the confidential and information is protected and folks' privacy is protected. The other thing is that the case manager may not have a work phone that has that is available to them or that has that option. So it depends on the CMH and what technology is afforded to their case managers.
Okay, thank you.
You're welcome.
We've got a few minutes left. I want to remind everyone that you can still submit questions until next Wednesday, July 1st, to me at jacksont7@michigan.gov. If you have questions that you think of after today, and we are going to try and create a frequently asked questions or a questions document, a document with questions and answers from the webinar today. And I'm gonna see one more time if we have any questions. I think we've got time to take one more. If there's someone that hasn't asked a question yet that wants to, we will give you time for the last question of the day. Belinda, it looks like that's it. I'm not seeing any.
All right, I want to thank everyone and have a great day. And if I don't talk to you before, enjoy your holiday coming up. Take care, everyone.
Thank you.
Thank
Bye-bye.
you.
Thank you. And as a reminder to everyone, we are off next Thursday, so there will not be a webinar.
Okay.
There will be no webinar next Thursday, July 2nd. But we'll see you back on the 9th at 11.
Yeah.
Okay, thanks, Tendra.
Be nice,
You're
Yasmina.
welcome.
Good to see you, Sarah.
Good to see you too. You're funny.
All right.
Sarah.
Have a good week.
Bye.
Thanks, everyone.
Okay.